How a COVID-19 outbreak could affect workplaces similar to influenza viruses. SARS-CoV-2, the virus that causes COVID-19, has the potential to cause extensive outbreaks. Under conditions associated with widespread person-to-person spread, multiple areas of the United States and other countries may see impacts at the same time. In the absence of a vaccine, an outbreak may also be an extended event. As a result, workplaces may experience absenteeism. Workers could be absent because they are sick, are caregivers for sick family members, are caregivers for children if schools or daycare centers are closed, have at-risk people at home, such as immunocompromised family members, or are afraid to come to work because of fear of possible exposure. Change in patterns of commerce. Consumer demand for items related to infection prevention, e.g., respirators, is likely to increase significantly, while consumer interest in other goods may decline. Consumers may also change shopping patterns because of a COVID-19 outbreak. Consumers may try to shop at off-peak hours to reduce contact with other people, show increased interest in home delivery services, or prefer other options, such as drive-through service, to reduce person-to-person contact. Interrupted supply, delivery. Shipments of items from geographic areas severely affected by COVID-19 may be delayed or cancelled with or without notification. Steps all employers can take to reduce workers' risk of exposure to SARS-CoV-2. This section describes basic steps that every employer can take to reduce the risk of worker exposure to SARS-CoV-2, the virus that causes COVID-19, in their workplace. Later sections of this guidance, including those focusing on jobs classified as having low, medium, high, and very high exposure risks, provide specific recommendations for employers and workers within specific risk categories. Develop an infectious disease preparedness and response plan if one does not already exist. Develop an infectious disease preparedness and response plan that can help guide protective actions against COVID-19. Stay abreast of guidance from federal, state, local, tribal, and/or territorial health agencies, and consider how to incorporate those recommendations and resources into workplace-specific plans. Plans should consider and address the levels of risk associated with various work sites and job tasks workers perform at those sites. Such considerations may include where, how, and to what sources of SARS-CoV-2 might workers be exposed, including the general public, customers, and coworkers, and sick individuals or those at particularly high risk of infection, e.g., international travelers who have visited locations with widespread sustained, ongoing COVID-19 transmission, healthcare workers who have had unprotected exposures to people known to have, or suspected of having, COVID-19. Non-occupational risk factors at home and in community settings. Workers' individual risk factors, e.g., older age, presence of chronic medical conditions, including immunocompromising conditions, pregnancy. Controls necessary to address those risks. Follow federal and state, local, tribal, and/or territorial (SLTT) recommendations regarding development of contingency plans for situations that may arise as a result of outbreaks, such as increased rates of worker absenteeism. The need for social distancing, staggered work shifts, downsizing operations, delivering services remotely, and other exposure-reducing measures. Options for conducting essential operations with a reduced workforce, including cross-training workers across different jobs in order to continue operations or deliver surge services. Interrupted supply chains or delayed deliveries. Plans should also consider and address the other steps that employers can take to reduce the risk of worker exposure to SARS-CoV-2 in their workplace, described in the sections below. Prepare to implement basic infection prevention measures for most employers. Protecting workers will depend on emphasizing basic infection prevention measures. As appropriate, all employers should implement good hygiene and infection control practices, including promote frequent and thorough hand washing, including by providing workers, customers, and worksite visitors with a place to wash their hands. If soap and running water are not immediately available, provide alcohol-based hand rubs containing at least 60% alcohol. Encourage workers to stay home if they are sick. Encourage respiratory etiquette, including covering coughs and sneezes. Provide customers and the public with tissues and trash receptacles. Employers should explore whether they can establish policies and practices, such as flexible work sites, e.g., telecommuting, and flexible work hours, e.g., staggered shifts, to increase the physical distance among employees and between employees and others if state and local health authorities recommend the use of social distancing strategies. Discourage workers from using other workers' phones, desks, offices, or other work tools and equipment, when possible. Maintain regular housekeeping practices, including routine cleaning and disinfecting of surfaces, equipment, and other elements of the work environment. When choosing cleaning chemicals, employers should consult information on Environmental Protection Agency (EPA) approved disinfectant labels with claims against emerging viral pathogens. Products with EPA-approved emerging viral pathogens claims are expected to be effective against SARS-CoV-2 based on data for harder-to-kill viruses. Follow the manufacturer's instructions for use of all cleaning and disinfection products, e.g., concentration, application method and contact time (PPE). Develop policies and procedures for prompt identification and isolation of sick people, if appropriate. Prompt identification and isolation of potentially infectious individuals is a critical step in protecting workers, customers, visitors, and others at a worksite. Employers should inform and encourage employees to self-monitor for signs and symptoms of COVID-19 if they suspect possible exposure. Employers should develop policies and procedures for employees to report when they are sick or experiencing symptoms of COVID-19. Where appropriate, employers should develop policies and procedures for immediately isolating people who have signs and/or symptoms of COVID-19, and train workers to implement them. Move potentially infectious people to a location away from workers, customers, and other visitors. Although most worksites do not have specific isolation rooms, designated areas with closable doors may serve as isolation rooms until potentially sick people can be removed from the worksite. Take steps to limit spread of the respiratory secretions of a person who may have COVID-19. Provide a face mask, if feasible and available, and ask the person to wear it, if tolerated. Note, a face mask, also called a surgical mask, procedure mask, or other similar terms, on a patient or other sick person should not be confused with PPE for a worker. The mask acts to contain potentially infectious respiratory secretions at the source, i.e., the person's nose and mouth. If possible, isolate people suspected of having COVID-19 separately from those with confirmed cases of the virus to prevent further transmission, particularly in worksites where medical screening, triage, or healthcare activities occur, using either permanent e.g., wall, different room, or temporary barrier e.g., plastic sheeting. Restrict the number of personnel entering isolation areas. Protect workers in close contact with, i.e., within 6 feet of, a sick person or who have prolonged, repeated contact with such persons by using additional engineering and administrative controls, safe work practices, and PPE. Workers whose activities involve close or prolonged, repeated contact with sick people are addressed further in later sections covering workplaces classified at medium and very high or high exposure risk. Develop, implement, and communicate about workplace flexibilities and protections. Actively encourage sick employees to stay home. Ensure that sick leave policies are flexible and consistent with public health guidance and that employees are aware of these policies. Talk with companies that provide your business with contract or temporary employees about the importance of sick employees staying home and encourage them to develop non-punitive leave policies. Do not require a healthcare provider's note for employees who are sick with acute respiratory illness to validate their illness or to return to work, as healthcare provider offices and medical facilities may be extremely busy and not able to provide such documentation in a timely way. Maintain flexible policies that permit employees to stay home to care for a sick family member. Employers should be aware that more employees may need to stay at home to care for sick children or other sick family members than is usual. Recognize that workers with ill family members may need to stay home to care for them. See CDC's interim guidance for preventing the spread of COVID-19 in homes and residential communities, www.cdc.gov/coronavirus/2019-ncov/guidance-prevent-spread.html. Be aware of workers' concerns about pay, leave, safety, health, and other issues that may arise during infectious disease outbreaks. Provide adequate, usable, and appropriate training, education, and informational material about business essential job functions and worker health and safety, including proper hygiene practices and the use of any workplace controls, including PPE. Informed workers who feel safe at work are less likely to be unnecessarily absent. Work with insurance companies, e.g., those providing employee health benefits, and state and local health agencies to provide information to workers and customers about medical care in the event of a COVID-19 outbreak. Implement workplace controls. Occupational safety and health professionals use a framework called the hierarchy of controls to select ways of controlling workplace hazards. In other words, the best way to control a hazard is to systematically remove it from the workplace, rather than relying on workers to reduce their exposure. During a COVID-19 outbreak, when it may not be possible to eliminate the hazard, the most effective protection measures are listed from most effective to least effective: engineering controls, administrative controls, safe work practices, a type of administrative control, and PPE. There are advantages and disadvantages to each type of control measure when considering the ease of implementation, effectiveness, and cost. In most cases, a combination of control measures will be necessary to protect workers from exposure to SARS-CoV-2. In addition to the types of workplace controls discussed below, CDC guidance for businesses provides employers and workers with recommended SARS-CoV-2 infection prevention strategies to implement in workplaces. www.cdc.gov/coronavirus/2019-ncov/specific-groups/guidance-business-response.html. Engineering controls. Engineering controls involve isolating employees from work-related hazards. In workplaces where they are appropriate, these types of controls reduce exposure to hazards without relying on worker behavior and can be the most cost-effective solution to implement. Engineering controls for SARS-CoV-2 include installing high-efficiency air filters, increasing ventilation rates in the work environment, installing physical barriers, such as clear plastic sneeze guards, installing a drive-through window for customer service, specialized negative pressure ventilation in some settings, such as for aerosol-generating procedures, e.g., airborne infection isolation rooms in healthcare settings and specialized autopsy suites in mortuary settings. Administrative controls. Administrative controls require action by the worker or employer. Typically, administrative controls are changes in work policy or procedures to reduce or minimize exposure to a hazard. Examples of administrative controls for SARS-CoV-2 include, encouraging sick workers to stay at home, minimizing contact among workers, clients, and customers by replacing face-to-face meetings with virtual communications and implementing telework if feasible, establishing alternating days or extra shifts that reduce the total number of employees in a facility at a given time, allowing them to maintain distance from one another while maintaining a full on-site work week. Discontinuing non-essential travel to locations with ongoing COVID-19 outbreaks. Regularly check CDC travel warning levels at www.cdc.gov/coronavirus/2019-ncov/travelers. Developing emergency communications plans, including a forum for answering workers' concerns and internet-based communications, if feasible. Providing workers with up-to-date education and training on COVID-19 risk factors and protective behaviors, e.g., cough etiquette and care of PPE. Training workers who need to use protecting clothing and equipment how to put it on, use, wear it, and take it off correctly, including in the context of their current and potential duties. Training material should be easy to understand and available in the appropriate language and literacy level for all workers. Safe work practices. Safe work practices are types of administrative controls that include procedures for safe and proper work used to reduce the duration, frequency, or intensity of exposure to a hazard. Examples of safe work practices for SARS-CoV-2 include, providing resources and a work environment that promotes personal hygiene. For example, provide tissues, no-touch trash cans, hand soap, alcohol-based hand rubs containing at least 60% alcohol, disinfectants, and disposable towels for workers to clean their work surfaces. Requiring regular hand washing or using of alcohol-based hand rubs. Workers should always wash hands when they are visibly soiled and after removing any PPE. Post hand-washing signs in restrooms. Personal protective equipment (PPE). While engineering and administrative controls are considered more effective in minimizing exposure to SARS-CoV-2, PPE may also be needed to prevent certain exposures. While correctly using PPE can help prevent some exposures, it should not take the place of other prevention strategies. Examples of PPE include gloves, goggles, face shields, face masks, and respiratory protection, when appropriate. During an outbreak of an infectious disease, such as COVID-19, recommendations for PPE specific to occupations or job tasks may change depending on geographic location. Updated risk assessments for workers, and information on PPE effectiveness in preventing the spread of COVID-19. Employers should check the OSHA and CDC websites regularly for updates about recommended PPE. All types of PPE must be selected based upon the hazard to the worker. Properly fitted and periodically refitted, as applicable, e.g., respirators. Consistently and properly worn when required. Regularly inspected, maintained, and replaced, as necessary. Properly removed, cleaned, and stored or disposed of, as applicable, to avoid contamination of self, others, or the environment. Employers are obligated to provide their workers with PPE needed to keep them safe while performing their jobs. The types of PPE required during a COVID-19 outbreak will be based on the risk of being infected with SARS-CoV-2 while working and job tasks that may lead to exposure. Workers, including those who work within 6 feet of patients known to be, or suspected of being, infected with SARS-CoV-2 and those performing aerosol-generating procedures, need to use respirators. National Institute for Occupational Safety and Health (NIOSH) approved N95 filtering facepiece respirators or better must be used in the context of a comprehensive written respiratory protection program that includes fit testing, training, and medical exams. See OSHA's Respiratory Protection Standard 29 CFR 1910.134 at www.osha.gov/laws-regs/regulations/standard number 1910.134. When disposable N95 filtering facepiece respirators are not available, consider using other respirators that provide greater protection and improve worker comfort. Other types of acceptable respirators include ARP95, NRP99, or NRP100 filtering facepiece respirator, an air purifying elastomeric, e.g., half-face or full-face respirator with appropriate filters or cartridges, powered air purifying respirator (PAPR) with high-efficiency particulate arrestants, HEPA filter, or supplied air respirator (SAR). See CDC, NIOSH guidance for optimizing respirator supplies at www.cdc.gov/coronavirus/2019-ncov/hcp/respirators-strategy. Consider using PAPRs or SARs, which are more protective than filtering facepiece respirators, for any work operations or procedures likely to generate aerosols, e.g., cough induction procedures, some dental procedures, invasive specimen collection, blowing out pipettes, shaking or vortexing tubes, filling a syringe, centrifugation. Use a surgical N95 respirator when both respiratory protection and resistance to blood and body fluids is needed. Face shields may also be worn on top of a respirator to prevent bulk contamination of the respirator. Certain respirator designs with forward protrusions, duckbill style, may be difficult to properly wear under a face shield. Ensure that the face shield does not prevent airflow through the respirator. Consider factors such as function, fit, ability to decontaminate, disposal, and cost. OSHA's Respiratory Protection eTool provides basic information on respirators such as medical requirements, maintenance and care, fit testing, written respiratory protection programs, and voluntary use of respirators, which employers may also find beneficial in training workers at www.osha.gov/sltc/etools. Respiratory. Also see NIOSH respirator guidance at www.cdc.gov/NIOSH/topics/respirators. Respirator training should address selection, use including donning and doffing, proper disposal or disinfection, inspection for damage, maintenance, and the limitations of respiratory protection equipment. Learn more at www.osha.gov/sltc/respiratory protection. The appropriate form of respirator will depend on the type of exposure and on the transmission pattern of COVID-19. See the NIOSH respirator selection logic at www.cdc.gov/NIOSH/2005-100/default.html or the OSHA Respiratory Protection eTool at www.osha.gov/sltc eTools Respiratory. Follow existing OSHA standards. Existing OSHA standards may apply to protecting workers from exposure to an infection with SARS-CoV-2. While there is no specific OSHA standard covering SARS-CoV-2 exposure, some OSHA requirements may apply to preventing occupational exposure to SARS-CoV-2. Among the most relevant are OSHA's Personal Protective Equipment (PPE) standards in general industry, 29 CFR 1910 Subpart I, which require using gloves, eye and face protection, and respiratory protection. See www.osha.gov/laws-regs/regulations/standard number 1910-1910_subpart_I. When respirators are necessary to protect workers or where employers require respirator use, employers must implement a comprehensive respiratory protection program in accordance with the Respiratory Protection Standard 29 CFR 1910.134. See www.osha.gov/losregs/regulations/standard number /1910/1910.134. The General Duty Clause, Section 5(1) of the Occupational Safety and Health (OSH) Act of 1970, 29 U.S.C. 654(1), which requires employers to furnish to each worker employment and a place of employment, which are free from recognized hazards that are causing or are likely to cause death or serious physical harm. See www.osha.gov Laws Regs OSHAC Complete OSHAC. OSHA's Bloodborne Pathogens Standard 29 CFR 1910.1030 applies to occupational exposure to human blood and other potentially infectious materials that typically do not include respiratory secretions that may transmit SARS-CoV-2. However, the provisions of the standard offer a framework that may help control some sources of the virus, including exposures to body fluids, e.g., respiratory secretions, not covered by the standard. See www.osha.gov/laws-regs/regulations, standard number 1910-1910.1030. The OSHA COVID-19 webpage provides additional information about OSHA standards and requirements, including requirements in states that operate their own OSHA-approved state plans, record-keeping requirements and injury/illness recording criteria, and applications of standards related to sanitation and communication of risks related to hazardous chemicals that may be in common sanitizers and sterilizers. See www.osha.gov/sltc/covid-19/standards.html. Classifying worker exposure to SARS-CoV-2. Worker risk of occupational exposure to SARS-CoV-2, the virus that causes COVID-19, during an outbreak may vary from very high to high, medium, or lower caution risk. The level of risk depends in part on the industry type, need for contact within 6 feet of people known to be, or suspected of being, infected with SARS-CoV-2, or requirement for repeated or extended contact with persons known to be, or suspected of being, infected with SARS-CoV-2. To help employers determine appropriate precautions, OSHA has divided job tasks into 4 risk exposure levels: very high, high, medium, and lower risk. The occupational risk pyramid shows the 4 exposure risk levels in the shape of a pyramid to represent probable distribution of risk. Most American workers will likely fall in the lower exposure risk, caution, or medium exposure risk levels. Occupational risk pyramid for COVID-19.